same time, the more you have time to listen to Dr. Chen. I have known Dr. Chen for a long time. That with the motion acupuncture, I definitely feel this is a great tool in soft tissue injury. It's neuromuscular treatment. With the acupuncture neuromuscular treatment, neuromuscular patient we have, I would say is probably is our core bread and butter. And that's the foundation, is probably the best, and we have best results. This is just another tool you have. I use them every single day, not on every patient, but in every single day, and especially in those chronic patients, and they not responded to other treatment. It does have people, they have, again, I just tell them, I said, well, you're not making progress like what I expected with regular smaller acupuncture needle. You're gonna feel a little bit, a needle in, and fairly, you can feel a little bit more, but sometimes you can needle out, or we'll remove more to the surface, you don't feel anything after that. So it's a very, very short period of time you can feel any discomfort. But work very, very effectively. So Dr. Chen, it's the, I tell you the secret, he's a founder, obviously. The secret is that in the needle. And the needle is very different than other needle. And you can see the effect of how the needle moves. Another thing is secret is this is a more, I call anatomy-based acupuncture. Like trigger point acupuncture is anatomy-based, and this is basically just another anatomy-based acupuncture. Okay, without further ado, let's welcome Dr. Chen to give us the presentation.
Thank you. Good morning, everyone. Thank you. Thanks, Dr. He introduced myself and motion acupuncture. Thanks ASA invited me to come here to give some introduction about motion acupuncture. Today, I'm so happy to be here to share my new knowledge and acupuncture technique. This technique we talk about motion acupuncture. Question. Did you heard about the motion acupuncture before? Okay, 1, 2, 3, a few people, maybe around 10. So today, we will let everybody know what is motion acupuncture. What is motion acupuncture can do? So since my around 40 years of practice acupuncture, I came to the United States since 2001. So 25 years in the United States, I'm as a teacher, professor in the acupuncture school, and most time I practice my acupuncture in my private office in Manhattan. I come from New York. So today only give me 1 hour. I use this limited time to let you understand and know briefly about motion acupuncture. Today we talk about only for soft tissues cause the pain. So the title is motion acupuncture for soft tissues pain. As you know, in United States, most acupuncture office, it practice acupuncture face to the patients with a lot of pain. Pain is not only for the medical problems, also it's a society problem. A lot of people take painkiller including fentanyl, whatever you know, kill a lot of people. So we must find a method to resolve the problems of the whole human with the pain. This pain in acupuncture office, article saw around 80% patients come to acupuncture office for pain. You agree that? For my office, I know my students every around this number. Okay, we see next slide. In the pain patients, around 95%, it is from soft tissues injury. Soft tissue is mostly regarding to the muscles, fascia, tendon, ligament, so and so. Everybody know it. But our needles only put in soft tissue. We never put the needles in the bone or internal organs. That's correct. So the needles effect in the soft tissue can resolve so many diseases, not only for pain. But today, we only talk about pain management because there's a lot of percentage of patients during our practice. Okay. Around only 5% the pain caused from others, like from a cerebral, from inside the spine, or from inside the joint, whatever. This give you surgery doctor to handle. But means 95% with the pain is our client, our patients, the big market. But how we handle that, how we can make the pain release immediately and range of motion in 1 minute. At the same time, it's changing, improved. Before I practice Haozen, regular filiform needles. Of course, filiform needle is the effect, but not like today the needles, motion needles is more powerful, like Dr. He already said, it's a different structure of the needles. Okay, this theory, motion acupuncture, including acupoint, motion acupoint, motion acutechnique, motion needles, and dynamic needles retention, and the whole system of motion acupuncture series. We have the book published, Chinese and English. Later I will show you. But today, I only let you know some of about the mechanism of motion acupuncture theory. I use a slide. Everybody knows the pain from soft tissue. 3 reasons to cause the pain: acute, traumatic injury, right? Accident, fall down, sport injury, acute. Second, chronic, strain, muscle overused, or same position all the time, computer, whatever, causes pain. The third one, you must know, we must understand from doctor, surgery, or some different treatment. After surgery, you cannot ignore that. Because some people after surgery, whatever disc herniation or ligament problems, after still pain, what do we do? So this is one of the reasons. Before, I don't have this one, only 2 reasons. But I found a lot of people after surgery come to my office. This most important patient, we have to face them. How to do it today. Okay. We see, when we get an injury, you have 3 pathogenic change in soft tissue. First, fascia must be damaged injury. Second, muscle, because the fascia cover the muscles and make muscles swollen, tense, tight, make muscles thick, short, whatever. This we call pathogenic change. Muscles, remember, fascia muscle. And then joints, please. Joints attacked by the muscles. Muscles control the joints. If a muscle you have problem, lost the balance, and then the joint must be mislocation, miss some position, and cause what? Limitation movement. For example, frozen shoulder. When we can do like that. Is normally, shoulder can do 360 rotating. No other joints can do. But when you have a frozen shoulder, what do you do? Only that. You do more. You remember? A lot of patients died. How we can one time use 1 or 2 needles, let them like that. Okay? Come to your office before, only that. After your 2 needles, maybe 1 needle, patient died. What happened? How can make it like that? Today, we see. I have a lot of videos, something show everybody, because in this conference, not allowed. I do demo. In other, conference, I do demo at the same time. You can see immediately, everybody pain release, range of motion much improve. Okay, you see how can do like that? How can have result like that? 2 things more important from the special needle, motion acupuncture needles. That needles will be first important technique is, traction the muscles with the limitation and unlimitation. What is the detail? I don't talk today. The second, patient must be movement with the needles. We call dynamic needles retention. This different from a traditional acupuncture stay needles, patient don't move. Don't move while you're waiting the qi coming. But we do the needles at the local and move the same joints. What means active the qi automatically by patient, not waiting the qi by without movement. Most traditional we do, me too, 20, 30, 40 minutes stay, don't move. Right? Everybody told your patient don't move. If move, guy was needle, bound, hurt, whatever. No, must be moved. And the doctor instruction how to move. In the book, I have a video, I have everything. You can see it, okay? This is the mechanism. You see the first one, the left side. When the pathogenic change of soft injury, what happened? Muscles, between muscles, the fascia stick each other. So cause the joints mislocation. That's the 2 symptoms will be occurred. What? Pain, unlimited movement, right? This is for pain. And second, the middle one, the needle is a motion acupuncture needle. It's like a tidy movement with the needle. And then after you see the right side, the muscles are separate. Joint come back, location normally. And then that means the pain go away and the movement like normally recovered. That's simple, easy picture. In my book, you can see it. This is the video we have to see. This is last year and 2003 and 4. I was in Europe, in America, Canada, China, a lot of places to introduce or give training class, training course about motion acupuncture. This is in the New Zealand, in Germany, Sweden, England, a lot of Europe countries, Canada, okay? We see this one. This is during the class. Anybody volunteer? If you have shoulder pain, please come in. Okay, 3 or 4 people coming. You choose the worst one. Which one you want me to do? I do. This doctor, acupuncture, massage therapy, physical therapy. He has 6 months. He cannot resolve her problems. During the class, a lot of students, I do 2 needles resolve her 6 months problem. You believe that? We see. This is the video.
Motion acupuncture while rubbing shoulders, Decheng in Netherlands.
This is the best doctor can do it. Before treatment. The backside limitation. You see the both arm imbalance. The left side okay, right side the best can do only 90 degrees. This is before treatment. Now start treatment. Do you know where I put the needles? Triceps, long head. You have to know which position. You see, 1 needles, they come on. With the needles, movement. See? After treatment? Yeah, give cheer. You see? What happened? 2 needles, you believe? That's before, left side. You see? Yeah. You see? So the most important where you put the needle, how you do manipulation for the point. So if you can handle these 2 important things, you get the result same like me. Not only my practice, doing I practice, you can see. But everybody, if you learn the technique, you can do by yourself all the time, same things. Okay, that's the book, Chinese and English. Chinese version published 2020. English just this month, April 15, 2005. So today, this book delivery may tomorrow to here. So now we don't have, but you can search essential motion acupuncture from Amazon, Google. You can find it. You can buy from the online. Okay. If you rush, if you rush tomorrow, probably delivery here. This topic, we have 35 articles published, Chinese version and English version. So this is in around the world. We promote the technique. We have a lecture, training class, conference, whatever, in everywhere around the world. Europe, you see, Moscow, Turkey, French, Germany, whatever, okay? And this different country, you can see it. Different time since 2023, I come to online, offline class, face-to-face. Before was all online. Online in Chinese version, we have around 66 hours class still there. Every Chinese can order to see, to learn. But the English version, we have some of no ready. You see, there's everywhere. We have a lot of places, China, Guangzhou, Beijing, Changchun, whatever in China, in Canada, Toronto, New York, today here, Washington. This is the media of the publish, the magazine or the newspaper around the, okay. This is the, these students talk about the motion acupuncture, easy to learn and quickly result. You get benefit for whole life. Of course, the technique when you learn, it belongs to you. Like you learn swimming, your whole life you have the ability to do it. You learn your whole life, you can use it. Nobody can take it from you. Whole life benefit. Okay. Another video, you see trigger finger. You meet a lot of patients have that. Medical doctor injection, surgery can be help or can be no. That's patient 1 year, acupuncture allowed, physical therapy allowed, injection once, cortisone, but still same things. Come to us, we do one treatment, immediately. You see? Close, and then open, middle finger, lock, trigger finger. Pain acupuncture, a lot of needles. Her sister, you see the anatomy picture there on the left side. It shows you where I put the needles. During my training class, all I talk about muscles, fascia, where you put the needle. You see, after needle, you see the needles on all needle on the forearm, no hand. That's the most important thing. Dynamic needle. You see, after treatment, they move free. No more lock. One year problems. We do only the treatment. The important that we didn't put the needles on hand or finger. You know, if you put needles on finger, on hand, it is most painful because sensitive from the nerve. We do far away on the forearm, even in the elbow, by the movement to affect to the finger. You never thinking about that? So that's very, you can try at home. When you go home today, you learn that. Most people, this video, some video in I have a YouTube channel. If you search my name, Decheng Chen, Dr. Decheng Chen, you can see thousands of video around the motion acupuncture, whatever, okay? So that's, you know, each where the pain. Today I pick up some cases. We have 7 videos to show you. This is the second one. Okay, this method, motion acupuncture, the first effect, you see quickly. But the result is stable. Not only you pain, and then second day coming the same things. Like the trigger finger, this patient only one treatment, disappear. 6 months later, one patient, same things, this finger come to me. I say, how you know me? Oh, there's one my friend mentioned her name, and then let me coming to see you. Oh, I said, yes, he has a middle finger, right? She said, yes. How about her? He said, everything, one treatment gone. So our treatment, you have to know, if you do correct things, 1 or 2 treatment, probably you get amazing result. You never believe happen like that. And the most important, the third one. This technique, if you learn, everybody can get the same result. Like some doctor, the presentation talk very good, result 90%, 99%. But when we use it, we cannot repeat the same result. Maybe we are not smart enough, stupid, but we don't know. This technique, the whole thing, if you learn, you go home, you practice with your patient, you get the same result like me. Okay, a lot of students, here, around like 10 students learn around the motion acupuncture, mostly Chinese. But from this year, I will promote in English students to learn motion acupuncture, to improve your technique, to resolve patients' pain, all internal organs problems also available. Oh, all right. Okay, the 4 things, you know, when you do the acupuncture treatment, first you face where you put the needle. Motion acupoint, you have to do. Which tools you do for the point? You have faithful needles, you have 3/8 needles, ear needles, typing needle, whatever, a lot of type of acupuncture tools. But we use motion acupuncture needle. And what the method technique you do, we have a special technique practice this needle. And the final one is different from range of, the movement with needles. We call dynamic retention needles. Okay. Motion acupuncture indication not only for pain, of course, anywhere pain from head, neck, shoulder, waist, whatever, whole body pain you can handle. But otherwise, the internal organs, stomach, colon, and pelvic, female, and so on. So you can see in my book, you can see different disease practice a different way because the fascia inside our body all linking together. By the movement, you can resolve all the internal organs problems. Very interesting. So that's a brief. So this in German. In German, also this patient have neck problems. This is the student. We see. Flexed angle. Extension angle. Remember the neck. Neck pain, right side. Okay. You see, extension angle. Before, after. One needle make extension better. Another needle make a flexed better. This is a technique, you see? Traction. Repeat this. Release. By the movement. The needle is still there. Okay, this is the extension. We see flexing. Yeah, here we only, you can see the video. It's not allowed to demo. I suggest in future, our conference must be at workshop because acupuncture is a practice. Not only see people talking, no meaning. You have to do something, let people see exactly the result. So in future, I suggest if I still have chance, I like to practice here. Everybody, low back pain, neck pain will coming. I fix that immediately, okay? Where put the needles? This is number one important. The point you select by 3 steps and 1 procedure. This motion acupuncture chooses the point. Oh, we don't talk about too much. This point not only local pain area, but also far away. It's like the light. The table light, probably the switch close to the light, the lamp. But the ceiling light, you cannot put the needles on the ceiling. You switch on the wall beside the door. So that's switch theory. We control the pain. If the whole room, if you come in very dark, you have to choose a switch, make it bright in the whole room, right? Motion acupuncture point like that. You have to find the point where you put the needle. Not everywhere can resolve the same problem. So this is the whole training class, okay? The 3 steps, 1 procedure. First, you ask a patient where the pain. You get the knowledge from which group muscles. Second, you do range of motion. You can see which muscles involved exactly. The third one, you do palpate. You find exactly the point on the muscles. And then you mark it. You put the needles. You get the result the same like me. Another video, if you like, we see.
方案内 statement， 动机跟治疗者将有。
This is in my office. Is it 2 weeks? Nothing. Limitation movement. See the muscle? We do the different muscles. So for SCI muscles and scaling. You see how to do, this is technique, you see, traction. After manipulation, movement much improve. Extension, flexing, rotating, whatever. Before, after, you see, much different. You see rotating left side. But no drive, dangerous. 2 weeks. Okay, so even all of the neck pain, but we choose a different point because the reason different. So that's why you have to learn the whole anatomy, whatever the system by 3 steps, 1 procedure, you found the point. That's the needles, motion acupuncture. We have a patent for this needle. It's different from a filiform needle, but look like a same filiform needles. Haugen, regular needle, same things. Each needle with the tube in 1 box, 100 needles. This is the needle's structure. You see, with 5 edges and spiral. See, this is the exactly needles on left side. The right side is by microscope to see. You see, there's needles. We have a video. This one, okay. You see, look like a nail and the screw different. You understand? But not like a needle, not like the screw exactly. Similar things. I just give you an example. Because the needles you buy hammer, screw you buy screwdriver, right? It's a different technique. That's the why we have, okay, this is, we see this one. This is the needle's structure with A's and spiral. Okay, patent. Another video for
动机治疗之后足底筋膜炎。
you see heel pain. Before treatment, we see her have plantar fascia. You see the needles, lower leg only, no foot. Only needle like that, and do some technique. Movement with needles, special technique. You see, still needle there, right? You're walking again, try. Okay, patient very happy and save her life. Okay, the technique, I just quickly to see the different, you see, this is all the motion needles for internal organs. This one have acid reflection and the IBS. Where you see, we can do like that. It's just to show you, you get different results for internal organs. You see? We treat a lot of technique you never thinking about that. When you learn this class, you get bright. Motion, the movement with the active, positive, or whatever. Okay, we get it. So 3 steps for motion acupuncture. First, choose the point. Second, technique. Third one, movement with needles. Another one, I don't know, we have 10 minutes to 12 minutes. That means the knee pain. Knee pain, one treatment. The knee pain medial side. They cannot squat. Squat best way like that. This is before treatment. We do the treatment exam first. 3 steps, 1 procedure. Okay. Okay. Exam from the point. Okay. The point is not the arch point where the pain. We have to check all the way related. You see, this is the technique. See? Cross release with needle movement. And then we see the result. Couple minutes, you get strange. The result unbelievable. You see, you can squat all the way better and better. You see, all the way down. This is still with needles. Remove needles, in the waiting area. You see, all the way. Okay. Anywhere, doesn't matter, neck, shoulder, waist, okay. So our class, we have online and face to personal, in person. All the class, we have the whole year of, later already set. So doesn't matter if anyone interested in the class can contact our assistants, Dr. Chao here, okay. Dr. Chao, let them know you, and if anyone interested can contact to her. Okay, this is the online classes. On the offline, the in-person class. Online, we have 5 phases, okay? Each one 12 hours, 60 hours, plus a basic class. Also, we have the group of the member for motion acupuncture in the world, not on the in United States. We have a different level, students and the group member, and also like special students, whatever. Okay, later we see that. Okay, some result we can see in different areas. This is in Guangzhou, you see. This thing every day happen in my office, a lot. So you see, people, this all in-person conference. Different result. Every people see in front of them to do something. The low back never can bond finger touch the wall, never. But one treatment, they can do it. Okay, extension also, this is the leg, whatever, low back pain, squat, whatever. This one, we miss that. We don't have enough time. I have 7 minutes. Maybe we can practice this one to see. Low back pain also either, cannot practice this one. Okay, this 2 code you can scan and enjoy our class. And this is our, we have website, motionacupuncture.org. A lot of videos there you can see. And otherwise, we charge. Also, we have YouTube channel. Put my name, Dr. Decheng Chen. You'll find 1,000 videos there. Okay. This is my office contact number and the email, whatever. If anybody have any questions, we have 7 minutes. I want to practice this video. I don't know why. They can do that. I mean, we can practice this. You can do it. I have a couple minutes. I don't know. Oh, here. Okay, got it. Thank you. Disc herniation. Diagnosis by Western doctor. You see this needle is already there with movement. We can find the west. Before. Okay. This patient let us know, doesn't matter diagnosis, disc herniation or narrow of the disc, whatever. We do only by our way. And then you get result unbelievable. Pain go away, range of motion free, and they can go to the work, whatever. Any questions, please?
5 minutes, the question. Anybody have a question? Who's first? Okay.
Can you release hammer toes with the motion acupuncture?
Hematos? What? What? Ah, if the toes cannot, okay. Okay, but doesn't matter what kind of problem or mislocation of the toes or finger. Just see if the muscles has a problem, we can resolve that. If not muscle problems, from other reason, from here or from the spine, whatever, from center, maybe not our case. But 90% case belong to us. So we have to do 3 steps, 1 procedure, exam, and then find exactly the point to do it. Next.
Your needle, the tip of the needle, is it fluid form or is it like a cutting?
Yeah, good questions. The tip of the needle is same like a Philippine needle. It's not like a knife. The tip needles are similar Philippine needles. So no like a 小针刀, 皮针, whatever. No any safe life. So safe. You don't worry about high risk to cut nerves or cut blood vessels or up. The important is the artery. No, don't worry about that. So this needles in America is legal to use and no any risk for our practitioner. Next. Yeah, we have a needle here in the room there. You can find it. Depend. Most people, maybe 1 treatment, maybe several treatment continue. Depend the case. If a long time case, many years, maybe need more. But some people, for example, the frozen shoulder, not only 1 movement limitation. They have this, they have this, or we can do several treatment. Depend. But some people maybe short treatment, 1 or 2. But some people maybe need more, 10, 15 available. Because the people also, today neck pain, tomorrow knee, after tomorrow the low back, you cannot do all the disease in one time, 1 by 1. Okay, next. Any? Sorry? Yeah. Yeah. Connective tissue, including soft connective tissue. We separate the second layer. I separate soft tissues 4 layers. First layer, skin. Second, the superficial connected, superficial fascia. The third one, dense connective tissue, is the deep fascia, and then the bone. So 4 layers. The treatment layer is the second and third. In my class, I first, doesn't matter you practice motion needle or practice regular needle. You have to know the tip of needles where in the soft tissue. This is the very important number 1 thing. And also you have to know the needling sensation, like a pain, numbness, the distension or heaviness, how you can get the sensation that patient. Actually, in the first class of motion acupuncture, I will let you know how to do to control the needling sensation. And the purpose, you have to know where the tip of the needles in soft tissue. That's the most important thing. Doesn't matter you practice what kind of needles. You have to know needles in your mind, in your heart. Even you close your eye, you know where the tip of needles in. Okay. Next. Yeah, we have a different training class. We have online, we have like in person, whatever. In future, you can visit our website to see more information about that. We have motionacupuncture.org. Going to this is the English, all English version. But this one is for my office, the website. Some English, some Chinese. Okay, I prefer everybody to visit our website. You can see more. The needles here, I just have some of with the company. If you're interested later, you can go there. The English version book may tomorrow delivery here. Okay, any question? I think it is the time for me. Yeah.
And how is it compared to a regular needle? What's the needle size? Do you have different needle size for this?
Yes, good questions. The needles, motion acupuncture needle, 3 sides, but same diameter, 0.3. The tip of the needles is the same like freeform needle. Only the body of the needle different. 3 sides, one is 40 millimeter, 1.5 trin. Second, 50 millimeter, 2 trin. Third one, 75 millimeter, 3 trin. So that's 3 side needles can use for anywhere of the body. Same things, when you use freeform needles, also you choose different size for different part of your body. Like a low back, it could be longer. If rest, you have to use a short one, but same things as freeform needle.
Bigger than regular needle. So the patient who's really afraid of pain, and is that similar to the regular needle or?
Yeah, even freeform needle also including 0.3 in diameter. But doesn't matter, depends you how to practice your skills. If you're skillful, patient do not feel too much pain, but you have to know the layer. Most of the time, second layer, soft superficial, loose connective, nothing pain, because no many nerves, blood vessel, whatever, so no pain. The pain only occurred in third layer level, third layer, muscles layer. You have to be careful. We have a method how to avoid patient get pain. In my class, we told that. Today, we don't have enough time. Thank you.
No, let me do it. Because I don't want to lose. Thank you. Okay, hold on. No, stay still.
Let me no block them. Okay.
Well, you didn't need to do that. Hold on. Just relax. I got it.
Okay. Thank you so much.
Thank you.
Okay, I mean, thank you. 哦，我来，我来，我来。给它关了就行，挺好的。